My name is Dejiar, lecturer, Faculty of Nursing, Assam Downtown University. So today I'll be teaching you on a demonstration on parenteral nutrition. So what is parenteral nutrition? It is an intravenous administration of varying combination of hypertonic or isotonic glucose, lipids, amino acid, electrolytes, vitamins, and trace elements through a venous access device directly into the intravascular fluid to provide nutrients to the patient who are unable to receive adequate nutrition through the GI tract. So the main purposes of this procedure is to provide nutrients required for the normal metabolism, tissue maintenance, repair and energy demands, to bypass the GI tract for the patients who are unable to take food orally. So the main indication for this is those patients who cannot tolerate enteral nutrition, maybe because of paralytic ileus, acute pancreatitis, any inflammatory bowel disease, any GI of the fistula, severe diarrhea, persistent vomiting, or any malabsorption. It is also indicated for those patients who are having any hypermetabolic states for which enteral therapy is either not possible or inadequate, like patients who are having an acute renal failure, multiple fractures, severe burns, as well as it is required for those patients who are at risk for malnutrition. So the methods of parenteral nutrition, it is mainly of three types. We have the total nutrient admixture, which is given to the central axis, peripheral parenteral nutrition, which is given to the peripheral vein, and the total parenteral nutrition, which is also given to the central axis. So the articles required for this procedure are the volume control infuser, the filters, bag of parenteral nutrition, administration tubing with allure lock connections, sterile gloves, face mask, and hypoallergic tape. So the procedure, we have to first assess the need for parenteral nutrition by doing the physical examination. We have to also explain the procedure to the patient, and we have to also review the physician order related to the administration of TPN, obtain the patient consent, and arrange all the articles required, and wash our hand thoroughly before doing the procedure. So after applying the face mask, we can prepare a sterile field by again rubbing our hand with the spirit. We have to attach the TPN bag to the IV pole. We can rub our hand again before, or we can wash our hand or rub our hand with hand rub before applying the sterile gloves. We have to make sure that the TPN bag should be touched by using the sterile gauze pieces for connection with the TPN tubing. We have to connect the TPN tubing to the TPN bag by following a sterile technique. We have to also, after that, we can attach the filter to the TPN tubing. We have to insert the tubing into the volume control infuser. Then regarding the insertion port, we have to make sure to maintain a sterile technique while connecting the TPN bag to the TPN tubing to the insertion port by wiping the hub of the ventral access device with a cotton ball for at least 15 seconds. Sterile cotton balls with spirit. We have to check the patency of the IV access. Then we can connect the tubing of the TPN bag to the insertion site, and we can keep it in place by using a lure lock connector or connection. We have to open all the access. Then we can regulate the flow by using the volume control infuser. After it's done, we have to monitor the administration hourly. We can assess the integrity of the fluid and the administration system, as well as the patient tolerance to the fluid. Then after it's done, we can record the procedure. Thank you.